Welcome back, everyone. It's Dr. Linder. In this next short video, we are going to be talking about planes. We have planes called the frontal plane, the sagittal plane, and a transverse plane. And these planes are important because when MRIs are done and PET scans and CAT scans, they're doing them in a three-dimensional uh, a plane or axis, and they divide them into different sections, and they take different slices within the section. So here, if we look at this young lady here, we see this plane going from front to back, right? Or it's going from anterior to posterior, right down the center of the body, and that is called the sagittal plane. The sagittal plane will separate the person into a left and right half, which is what we see here. This is what you get in a sagittal slice. Okay, let's change the color here. We'll make the next one, let's make it green. Then we have this one here going from left to right. And when it goes from left to right, it's going to separate the person into an anterior portion and a posterior portion, or front and back. Another name for this frontal plane is called a coronal plane. Coronal. And this will be important because when we do osteology and we look at the top of the skull, let's say we cut the top of the skull like this, there is a line that runs this way called the sagittal suture, and then there's another one that goes this way from left to right. This is anterior to posterior. So when it goes across, they call this the coronal suture. And when it goes this way, they call it the sagittal suture. The sagittal suture separates the skull into a left and right half, just like the sagittal plane does. The coronal suture separates the skull into an anterior and posterior portion, much like the frontal or coronal plane does. A transverse plane is this one here. We'll change it into black. So this one here that separates the body that way and makes a cut, looking at the body from anterior to posterior, left to right. It's like a bird's eye view looking down and into the body. That's called a transverse plane. So if we look here, this is a transverse plane. This one here, going right down the center, that's either a mid-sagittal plane or a sagittal plane. When it's mid-sagittal or sagittal, it separates into an equal right and left half. But this line here, it's a sagittal, but they call it a parasagittal. Parasagittal still will separate into a left half and a right half, but they're obviously unequal distribution there. Okay, and I want to go back here for a second, right here. This, if we were to extend this line up here to here, it's crossing the clavicle midway, so they call this the mid-clavicular line. They call it the mid-clavicular line, okay? All right, so now matching. All right, we got coronal, which remember is also known as frontal. Frontal or coronal. That's going to divide the body into a front and back, or anterior and posterior. If we look at the transverse, that's the bird's eye view, separating to a superior and inferior half. Mid-sagittal, it divides into equal left and right halves, and then parasagittal is unequal left and right section. So this one here is parasagittal, and then this one here, sagittal, equal left and right half. All right, now, everyone here wants to jump and go, oh, we know this is the right lower quadrant, got it. But look at the question. What is the medial border of the highlighted region called? Okay, so here is the superior border. Here's an inferior border. This is the medial border. And this one here is the lateral border. So what is the medial border called? Well, what is this line that's right down the center? That's going to be the sagittal plane or mid-sagittal. All right, now many of you want to say, all right, this is the umbilical region, this is the epigastric, and then this is the hypogastric, and then this is the flank or the lumbar, flank or lumbar, and then this is the hypochondriac here and here. But look at the question. What is the name of the line that makes the medial border of the highlighted region? Okay, so here's the inferior border, here's the superior border, here's a lateral border, here's the medial. So this line, as we said, let's follow it up, goes right down the center of the clavicle. That's the mid-clavicular line. Okay, we'll take a break. When we come back, we'll talk about cavities.